Hey guys, it's Dr. Perry coming at you. I'm going to show you one of my favorite treatment techniques for part of the body that I talk about all the time in my workshops. I jokingly say it's my favorite fascia in the body because everybody's got to have a favorite fascia. It's your thoracolumbar fascia, and that's the bridge of connection between your shoulder and your opposite hip. It's one of the biggest things that I teach people how to take care of and also optimize in training with my Primal Movement Chains workshop. So I'm going to be doing a treatment here to brand new Stop Chasing Pain assistant, Louisa, who's been a dear friend for forever. You want to come on and say hi? Because they're going to see your back in a second. There's Louisa. So you're going to help me run the asylum of Stop Chasing Pain. And I'm going to show you how I do my rail reset system. So the rail stands for release, activate, integrate, locomotion in that particular order. So you're going to see me do some laser treatment on the back and some instrument assisted work on the back, which I think she's probably going to like those too. And then I'm going to put some rock tape on that area that we treat, and then I'll show you how we integrate that into a movement pattern, and then we get up to the last part, which is the L, which stands for locomotion, which is basically just getting off the table and walking and getting back to life again. So I hope you like it. If you have any questions on that, you can reach out to me all the time at stopchasingpain.com. All right, so we're going to start first with deep tissue laser therapy. This is a 25-watt laser from Light Force Therapy Lasers. I've been using it for about 10 years. We're going to treat right here along the whole part of the thoracolumbar fascia for about, let's see, 3 minutes. We're going to do a treatment on it. I'm going to put my safety glasses on, safety first, right? And this is going to help relax the tissue down and begin to get this guy ready for the soft tissue work that we're going to be able to do and the movement. Okay guys, the laser part's done. Now it was about a 3-minute treatment. Now I'm going to move into the instrument assisted soft tissue manipulation. Big mouthful there. I'm going to use the Hawk grips. My bad boys from Hawk Grips. Show you how we use this to release the tightness in the fascia, get that thing moving better, and then we're going to seal some rock tape over that sucker and get her moving. So here we go. So you're going to put a little bit of the emollient on the skin. It's be a little bit cold, okay? And then we're going to use the tools here. The tools just help save your hands, and they also begin to just break up the tissue. So I know you really can't see so well from there, but you're just going to start to scan the tissue and feel areas where it gets a little restricted. There's a few in here. And then it's really simple. You just start rubbing over it. Usually about a 4 to 5 minute little treatment. Yeah, a little sensitive there, aren't you? Okay, so you guys can see what it looks like on the area after you do just about 2 minutes of the instrument assisted work. Opening that area up. Now we're going to get some rock tape love on there. Okay, now we're on to the rock tape part. So this is going to be a mix of activation to integration. So it's going to help bridge the transmission of force across that thoracolumbar fascia, what we call the posterior oblique subsystem. So we're going to measure the tape all the way across here. We're going to cut it. So it's going to be right at the center of T12L1, hence thoracolumbar fascia, a little piece of both. Then this is the rock tape, Big Daddy tape. And it's even more special because it's got the Stop Chasing Pain logo on it. Can't beat that. So then we're going to tear this in the middle. And then Louisa is going to bend forward a little bit. So we want to load to explode the tissue. So we stretch the tissue.
I got no strength left for the waist now. I can't
Then what I'm going to do is I'm going to pull this guy about 50%. Lock it here.
All right. Okay, you got to get up. If we go out, I'll text you.
And then now it's going to sit over here. When she sits up, it's going to give her some nice support. All right, you've got the so now you've got the tape supporting the thoracolumbar fascia, and it may be able to see the angle, but there's some wrinkles in there, and that means you'll get a nice lift on the fascia for support. And patients and clients freaking love this one. Okay, so now we're going to move into the integration part, and this is actually a really cool move that I use in my Primal Movement Chains course, and I saw it first and give props to Pete Egoscu from the Egoscu method. Really awesome stuff. So we're going to give you how I actually break it down a little bit into different quadrants, making it a little bit easier for you to own the pattern. Here we go. Okay, so what Louisa's going to do is she's going to actually raise her right leg up in the air just a little bit, and now she's going to raise her left elbow and head up off the table, and she's just going to hold, and then she's going to relax the arm down, then the leg goes down, and you can see the other arm is down by her side, and her head is resting on the back of her hand. Now she's going to try it the other way. The elbow and head are going to come up first, and now the opposite side leg goes up. She's going to hold. This is going to lower the leg, lower the arm, and then now what she's going to do is both together. Arm goes up, leg goes up, and she holds, and she lowers down, and she would do about 4 repetitions, and then we would actually begin to go and do the same matrix on the other side. Okay guys, so there you have it. I mean, that's a primary example of the rail reset system. So how you feeling over there?
Good.
Pretty good? Yeah?
Mm-hmm.
She wanted me to do a whole nother take to get another one. But that's one of the most powerful things that I do for everyone. And I jokingly say that if you come under to see me and you have a hangnail and nobody can figure it out why it keeps coming back, I'm doing this to your thoracolumbar fascia. It's that critical, that important. So check out more information and more videos on StopChasingPain.com. Also our new membership site that is launched, and you'll see a lot of really cool things like this every single week coming your way. And check us out on one of our upcoming workshops of Primal Movement Chains, Moving Beyond Mobility. Dr. Perry signing off. Luis from Stop Chasing Pain signing off. We'll see you soon, as always, on the other side. Perfect.